My name is Dr. Komoshi. I'm a GP at Kingston's Medical Practice, Ashford. In this series we look into common medical conditions that could be treated at home. Have you woken up with razor blades in your throat? When you look into the mirror, it looks red, inflamed. There might be some ulcers on the tonsils. It looks like an infection. Do you need to call the doctors? Would they just say, oh, it's a virus, take paracetamol? Or do you need antibiotics? How would you know? Well, let me give you an insider look, as it's not rocket science. Most GPs work by what's called the center criteria. 4 things to take into account. 1 is high temperature over 38. 2, it's pus on the tonsils, like those white grey streaks or dots on the side of the tonsils. No cough and enlarged lymph nodes on the side of the neck, which is lumpy, tender neck. If you have 1, 2 of these, it's very unlikely that you have a bacterial infection. However, if you have 3 or 4, the likelihood is higher, from 32% up to 56%. It means that even if you are positive for all the 4, it's still nearly half of the cases viral infections. However, if you are positive for all the 4, most GPs would offer you antibiotics. It's good to know that antibiotics would reduce the illness duration only by 1 day. However, it's true as well that since the use of antibiotics for respiratory tract infections, the complications of tonsillitis, like inflammation of the kidneys, joints, or heart, like rheumatic fever, are very, very rare. So the typical tonsillitis story in a child is a sudden fever that comes out of the blue. The child becomes lethargic, doesn't want to eat, just lays on the sofa, wants to sleep. In young children, aged 2 to 3, they might not even complain of sore throat. However, in older children, the sore throat could be a prominent symptom. And then when you look into their throat, then you will see the typical enlarged tonsils with the white dots or streaks. They will complain of the neck hurting on the outside as well. And they don't have cough, cold, sneeze or runny nose. In these cases, antibiotics would be indicated. On the other hand, if the child starts with a runny nose, sneezing, coughing, then it's likely a viral infection giving them the sore throat and the temperature. When you look into the throat then, you will see it's all red, raw, inflamed, and the tonsils also could be enlarged. And even the dangly bit in the middle, called uvula, might look red and enlarged. This is the typical picture of a viral throat infection. In these cases, antibiotics wouldn't work. However, you might want to take paracetamol or ibuprofen for the pain. You can use salt water for gargling, throat lozenges like strepsils, or Difflam spray, which is an anti-inflammatory spray, to ease the symptoms. We expect the temperature to settle within about 5 days and the sore throat to resolve after 7 days. The cough can linger around for up to 3 weeks, and there's not much we can do about that. It's good to know that sore throat due to viral or bacterial causes, self-limiting conditions, which generally resolves within 2 weeks. However, there are some cases when we suggest that you see your doctor. Number 1, if you are immunosuppressed because of your condition or the medication you take. 2, if you have breathing difficulties. It doesn't mean that with blocked nose it's difficult to breathe through your nose, but if you genuinely feel short of breath, we definitely need to see you. Number 3, if you or your child is not immunized against more serious sore throat diseases like measles, mumps and diphtheria. In these cases, I would encourage you to have a very low threshold to see your doctor with any kind of sore throat diseases. Number 4, if the sore throat is not improving after a week or the temperature continues beyond 5 days. There might be some complications at the background. Number 5, dehydration. Sometimes with a sore throat, the children refuse to drink and then they can have dehydration. We expect at least 2 wet nappies or 2 urinations over 24 hours and at least 50% of their fluid intake. If it's less than that, please contact your doctors. Number 6, if you're unable to swallow your own saliva and is drooling out of your mouth, this could be a sign of quinsy, which is an infection behind the tonsils forming an abscess. It needs hospital treatment. You see that the dangly bit in the middle is shifted to one side and the 2 arches are distorted. And the bulge on the side is where the abscess is. This is quite rare, but still can happen, so be vigilant. Now, after this mini tutorial, let's see this picture, and you can guess what's wrong with this patient. Well, this is a normal picture of a throat. You see that the tonsils are quite large, however, this is normal at young age, before the age of 6. You see those little indentations, craters on the tonsils. They are not ulcers. This is the normal structure of the tonsils. Later in life, the tonsils go into atrophy. It means that they just diminish, get smaller, and the structure becomes less noticeable. I would encourage you to have a look into the mirror to check how your tonsils and your throat looks when you are healthy, and do the same with your child. And they will get used to allowing you to look into their throat, so when they are ill, you will have a quick glance and you can decide whether any intervention is needed. I put a link into the comments with a very useful video how you can take a good quality picture of your throat in case you want to send it to your doctors through e-consultation for evaluation if you're not quite sure whether your throat is infected, whether you need antibiotics. It's quite common to have tonsillitis at young age. However, if there are frequent and recurrent tonsillitis, it could be treated with tonsillectomy. The current criteria suggest there are 7 or more tonsillitis episodes in 1 year, or 5 in each year in 2 consecutive years, or 3 in each year for 3 consecutive years. You could be referred to ENT for further assessment. I hope that it helped you to decide whether you need to call the doctors and when you need to worry, and then it is only a question of time and you will get better. I wish you a speedy recovery.